Hello and welcome to Medical Dialogues. I'm Mr. Zaman and here's what I bring to you all from the world of medicine. Negative effects of unhealthy sleep duration on longevity may be reduced by exercise, finds study. Sleeping too little or too long is linked with a shorter life, but scientists have found that physical activity counteracts some of these negative effects. The research in more than 90,000 adults is published recently in the European Journal of Preventive Cardiology. The study included 92,221 adults aged 40 to 73 years in the UK Biobank cohort who wore an accelerometer wristband for 1 week between 2013 and 2015. The average age of participants was 62 years and 56% were women. During a median follow-up of 7 years, more than 3,000 participants died, 1,074 from cardiovascular disease and 1,871 from cancer. Hope for heart failure patients in novel drug. A novel drug is showing promise for alleviating heart failure, a common condition associated with sleep apnea and a reduced lifespan. The drug, known as AF130, was tested in an animal model at Waipapa Tau Mata Rao, the University of Auckland, where researchers found it improved the heart's ability to pump, but equally important, prevented sleep apnea, which itself reduces lifespan. This drug does offer benefit for heart failure, but it's two for the price of one, in that it's also relieving the apnea, for which there is currently no drug, only a breathing device, which is CPAP, which is poorly tolerated, says Professor Julian Patton, director of the university's Manaki Manawa Center for Heart Research. Key risk factors for surgical site infection following commonly performed surgery identified in study. Findings from an analysis of more than 66,000 abdominal hysterectomies performed in New York hospitals reveal key risk factors for surgical site infections or SSIs following these procedures, including open surgery, obesity, diabetes, gynecological cancer, and age under 45. Published recently in the American Journal of Infection Control, the data can help inform surgical and clinical decisions to reduce post-operative infections. SSIs are infections that occur at a surgical incision site within 30 days after the incision is made. To identify the risk factors for SSI after abdominal hysterectomy, Dr. Seren Punsang and colleagues used data reported in the National Healthcare Safety Network from 66,001 abdominal hysterectomies performed over 4 years at all acute care hospitals in New York State. They augmented these data with diagnosis codes available in administrative data. Some melanoma patients with leptomeningeal disease benefit from novel immunotherapy delivery approach. A novel approach to administer intrathecal or IT immunotherapy, that is directly into the spinal fluid, and intravenous or IV immunotherapy was safe and improved survival in a subset of patients with leptomeningeal disease or LMD from metastatic melanoma, according to interim analysis of a phase 1 and 1B trial led by researchers at the University of Texas MD Anderson Cancer Center. The study, published in Nature Medicine, represents the first in-human trial of concurrent IT and IV nivolumab, which is an anti-PD-1, in melanoma patients with LMD. Across 25 patients, the median overall survival was 4.9 months, with overall survival rates of 44% at 26 weeks and 26% at 52 weeks. 4 patients survived to 74, 115, 136 and 143 weeks after their first IT dose, which is significantly longer than expected. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.